We have Dr. Helvie here in studio. She's a pediatrician, long time here in the Eastern Sierra. So I know my girls are in their late 20s and early 30s, and they saw you. So anyway, Dr. Helvie, we've had an ER doctor, a general practitioner, a geriatric practitioner. So it seems only natural to have someone that deals with the children come in. So thank you so much and welcome to the Sierra Wave.
Well, thank you for having me, and I love to have the opportunity to talk about how this crisis is affecting kids.
And I know one of the big things, just from being a dad, it's important on how you approach the children. How do you explain this pandemic worldwide? Because people are panicking and all that. We don't want to have them panic or take it too lightly. So how do you talk to kids about COVID-19?
Yes, it can be really tricky to talk to children about something like this. And of course, it can really depend on the age of the child too. So not everything I say might apply to children of all ages. But kids, unfortunately, will often get just little snippets of information here and there from media or friends and may have a very warped sense of what's really going on. So one of the best things you can do with kids of all ages is to ask them about what their understanding is or what they think they know so far, and then talk about some of the myths that they may have picked up along the way.
So if the kids are worried, as you said, they probably will be because they're hearing, and they're not in school now, so they know obviously it's not just a big spring break. So what can we do as parents, aunts, uncles, whatever, to help kids with their worries over the COVID-19 pandemic?
Yes, there's a lot of things that one can still do. And of course, we all have our worries about what's going on. And it's important to discuss those things with children as much as possible, again, in an age-appropriate manner. But simple reassurance can really help kids a lot. One of the things that's really reassuring for children is to know that adults are doing whatever we can to keep kids and everybody in the community safe. So talking to children about how researchers and doctors are learning as much as they can, as quickly as they can about the virus, and taking steps to keep the community safe is really important. It can also be helpful to give kids some control over the situation by talking to them about things that they can do to help decrease the spread of the virus. There's common sense measures like washing hands well, and the stricter social distancing procedures that have come into place recently. Basically, the more you stay away from people, the less the virus gets spread. And why that's important, it may be hard for kids to understand. It's important to be a good role model with those things yourself.
And that seems almost counter to what we've been teaching the kids. I know, come on, get in there, get in close, be sociable, learn your social skills. And now the game has changed completely for all of us. So but like you said, that you want them to gain knowledge, because when you gain knowledge, anxiety goes down usually. I'm not sure about a pandemic. This is my first worldwide pandemic. So what are the signs of anxiety to watch for in children?
Yeah, children may have a hard time expressing their anxiety, and it can come out in a lot of different ways in kids, often with changes in behavior, certainly things like nightmares or panicky kind of behavior, but also more subtle signs like just getting more frustrated easily, getting upset about little things that might not normally bother them can be signs of anxiety. And again, continuing to talk about those things with children can be really helpful. Helping to figure out what it is they're worried about may help too. You might be surprised when you're worried about the virus or getting sick from it. A child may be worried about running out of toilet paper, which they hear about on the news constantly. So identify what it is that's worrying them, and then help them come up with a plan or talk about how adults are helping with those things. You have stocking food in the house to make sure you have enough to get by. And other supplies if that's something that they're worried about too.
Now, recently I was at one of our stores and somebody recognized me. They said, well, I understand why the older people need to stay home. And I understand why. She was a person about my age, late 50s, early 60s, and why people over 40 need to stay home. But kids, they seem to be almost bulletproof to this. They're getting ill, but they're not dying from it. Why do the children need to practice social distancing?
Yeah, and it really does seem to be lucky that children don't get as severely affected by this illness, but that doesn't mean they're not going to get sick. In places where they've had cases and can look at the numbers, about half of kids who get COVID will have mild symptoms, but still about 1 in 15 will have symptoms that are severe enough to need care in the hospital, have problems with their breathing or hydration. And that's true especially in the younger infants and children. So we do want to protect our kids as well. But one of the bigger reasons is that kids also, especially if they have mild illness, may be spreading the disease around the community, and are often the ones that affect adults or grandparents in their lives who may be more susceptible to the virus. A lot of how the virus is transmitted is really not known yet, but it does appear that people without symptoms or with very mild symptoms may also be spreading the virus around the community. So the best way for everybody to stay safe is for everybody, regardless of age, to stay as far away from each other as possible and not go out if it's not necessary.
Now, how are you handling it at your office? If someone, or what do you recommend for your patients if they suspect that their child may have the COVID-19 virus? Do you want them coming in? Do you want them calling?
So typically right now, you're always welcome to call our office for advice. Mild symptoms can be treated at home with the self-quarantining measures that are recommended by the health department. If there are concerns that the child may be having trouble with breathing or with dehydration from not being able to drink well, those children may need to be evaluated in the office setting. It's important to call first so we can appropriately separate sick children from other people and to keep our healthcare workers as safe as possible by using protective equipment when we need it. So call first. We'll talk to you about what symptoms your child is having, and then we'll figure out the best plan of action.
Okay, and that's during normal business hours that they can call your office?
Yes, we continue to be open during normal business hours, including on Saturdays.
Excellent. And if it's not normal business hours, who should they call? Or what should they do?
Outside of normal business hours, we do have an after-hours advice line, RN advice line. That's a nationwide system that we use to provide information to our patients. They do have a protocol that they're using to question families about COVID symptoms and help determine what they should do for their children. If you call our office, that number is on the after hours voicemail. And so that is a good resource if you're ever worried about your child after hours, as far as difficulty breathing especially. That would be a reason to go to the emergency department, but make sure to read the signs and to follow their check-in procedure there also.
And I know with my girls, it always seemed to strike after hours.
Yes. Kids always do seem to get sick after hours.
They do.
Again, most symptoms in children can wait until the morning unless they're severe.
So like you said, respiratory, the stress, something that may be life-threatening, don't wait until morning, obviously.
Right, absolutely. But if it's some fever and you can treat it with some ibuprofen or Tylenol at home and call the office in the morning, it's best to avoid the emergency department if possible, since they are going to be seeing high numbers of patients than usual.
Now, they've been talking the last few days about this possible alternative treatment with Z-Pak and a malarial treatment. Are those things that children can take?
Potentially they are, but there's a lot of different medications under investigation for their potential use. And as of this time, we still don't have enough information to show that any of them are particularly effective. There's certainly no magic bullet that's been discovered. But should any of those medications turn out to be helpful for the treatment of COVID, they are medications that can typically be used in children also.
So is the standard of care for a child that's infected different from grown-ups, or is it the same? Are we kind of treating the symptoms?
Yes, really in everybody we're going to be treating the symptoms, mostly with breathing problems, and whether or not there's a need for oxygen or supportive care will be what determines if patients need to be treated in the hospital or if they're able to stay at home.
Now, since we are in a rural area, whether it be Mammoth, Bishop, Lone Pine, we have very limited beds in the hospitals. So that's another part of the social distancing, I assume, so that everyone's not going at the same time.
Absolutely. The really important thing with the social distancing measures, and one of the great reasons for the school closures has been to try to decrease the spread in the community. We want to slow it down as much as possible. People will still get sick from this illness, but if we can manage just a few people at one time, we can take much better care of them than if we have a huge rush of people getting sick at the same time. So spreading out the rate at which this illness spreads through our community so that we can optimally take care of patients is really important.
And one thing I've noticed that kind of annoys me a little bit, and nothing to do with you, that if you talk to people, you wash your hands, you socially distance. And I was at a restaurant recently before they all shut down. It was happened to be a Mexican restaurant, and they're touching the hard surface, the doorknob, which goodness knows what's on there. Oh, chips and salsa. And no one was, they weren't washing their hands. So it's one thing to know, I have to wash my hands, I have to socially distance. People out there, please do it also.
Yeah, very hard to practice new routines. Even just remembering not to shake somebody's hand can be quite an active thought process, since these are things that we're so used to doing, but so important. So yes, keep thinking about everything you're doing, everything you're touching, and try to minimize as much as possible.
Well, it's kind of funny. One of the physicians that we had in, I won't say who it was into fist bumping. And then we fist bumped on the way in. And then during the interview, the doctor had an itchy nose and was doing this and then wanted to fist bump me. No, I don't.
Yeah,
think about where your hand has been.
You have to be closer than 6 feet in order to fist bump or elbow bump or knee bump anybody.
This is true.
So stay 6 feet apart and wave.
Great advice. I hadn't even thought about that. I'm in my little cubicle here, and I keep the door closed. And I go home, and my wife works at a bank, and I make she has to wash her hands. She's very good about it also. But yeah, we're not keeping the 6 feet, but just for the purposes of this interview. I'm sorry. So do you have anything else?
I think one other thing I'd really like to say, as far as kids are concerned, your children are very impressionable. Again, they are going to be worried about this. They pick up on their parents' anxiety. It's very difficult not to. So keeping good communication with your kids is important. But be a good role model for kindness and compassion for people who are getting sick from this disease. Be really careful around children to avoid language that implies that we have control over who gets it. Saying things like, oh, that person deserved to get it. Or if you're not good, you might get sick. Things like that can be really detrimental for children. We're all in this together. This virus is not going to discriminate between who it affects and who it doesn't. It has nothing to do with personality or race or any other features. So remember to model that to children. Speak kindly of people who are suffering in a whole variety of different ways that we will be struggling with over the next several months.
That's very good advice. And unfortunately, in a way, we're focusing on those things, washing our hands, good hygiene, being kind to each other. So hopefully when this ends, which it will, we've come through everything so far, that when we do come out the other side, we might even be better people and a little bit better society than when we went in. That's my hope anyway. Obviously, we're all hoping to be better and improve. My wife happens to be from Asia, and she's gotten a little... She has allergies. She has seasonal allergies. And so every once in a while, and when people look at her, it's just, she hasn't been in Asia in 40 years. she's not a carrier of it. But regardless, yeah, we need to not, like you just said, discriminate against anyone because the disease knows no boundaries. And if we do things intelligently, socially distanced and those things, we'll come out the other side of this, hopefully with a minimal amount of damage to people. People will die,
Yeah,
which is horrible.
It's nice to think that we might come out of this as a stronger community and as better people, as well fed.
And I know that's during my show every day. That's what I'm talking about. That the set we're playing right now is about magic, and then the wrap up on it is that we possess the magic, and that hopefully we'll come out better people and a better society on a whole.
Yeah, the only part of this virus that we can really control at this point is how we react to it and how we help each other during this crisis.
Very well said. Anything else?
That's all I have for now, unless you have any other questions.
No, I'm good. I think you covered it very well. Dr. Helvie, it's a pleasure having you here at the Sierra Wave. And anytime that you want to come in, the door's always open to you.
Thank you for having me.
It's my pleasure.